Have you ever considered breast augmentation, but you're not really sure where to start? Hi, my name's Kayla Thomas, and I'm here today to get some answers to some of the most common questions about breast augmentation. Joining me is Dr. Perry Johnson. He is the Chief of Plastic and Reconstructive Surgery at Nebraska Medicine. Thank you for being here.
Thank you for having me.
Well, one of the best places to start is obviously finding a practice or a physician. What do you recommend people look for?
Well, I think there's a lot of information out there, and number one, you want to look at a practice that specializes in breast augmentation. So that's important. How many patients do they do a year? As far as individual physicians, you want to ensure that they are board certified by the American Board of Plastic Surgery, which is the official sanctioning body of plastic surgeons. I think when you do visit with that physician, it's important that you just have a good feel and a trust that that person's going to do a good job and take good care of you. Look at before and after pictures, word of mouth, ask friends, family, your doctor, who they would recommend.
When it comes to the surgery itself, what can people expect from that? Is it painful? Do I need to take time off work? What's the recovery like?
The recovery typically is a week. And as far as work goes, it kind of depends on what you do. If your job is primarily sitting at a desk working on a computer, even a few days is long enough for a lot of patients. On the other hand, if you're a carpenter and you're lifting heavy 50-pound bags of cement, things of that nature, it could be 4 to 6 weeks before you have unrestricted activity in that regard. But generally speaking, it's a pretty easy recovery.
Is there anything you recommend as far as lifestyle changes leading up to surgery? Diet, exercise, lifestyle, those sorts of things?
The main lifestyle change is if you're a smoker, stop smoking. Because generally you can't smoke, just negatively impacts wound healing. And then, of course, we promote, if you're going to be focusing and spending money on these kinds of things to make you look better, you need to be committed to the other things, eating a healthy diet, regular exercise, and just promoting that healthy lifestyle.
You want to feel good overall, so you feel good about this decision.
Yeah, absolutely.
What about the surgery itself and risks? Obviously, anytime you think about a surgery, you think about the risks associated with it.
It's an outpatient surgical procedure that takes maybe an hour typically. Risks, like most surgeries, bleeding, infection, scarring. Specific to implant surgery, you can have a rupture of that implant over time. You can also develop scarring around the implant that sometimes can make the implants hard, maybe in about 5% of people. And then you can have implant malposition where implants can shift up or down. When you look at all those potential complications, maybe a 5 to 10% risk of either a minor or major complication.
This is the kind of surgery I would assume you don't just send people out the door and they're on their way. Are there follow-up appointments?
Yeah, typically they would come back and see us the next day, a week later, a month later, 3 months later, and then at a year, and then we see them annually.
To make sure that everything's still in place, they're still satisfied, everything still looks good.
Exactly.
A couple questions that I think come up commonly when it comes to breast implants. Breastfeeding. Are women who get implants still able to breastfeed?
Yep. There's no problem with that. Typically we put them either under the muscle or directly under the breast tissue, and so the breast tissue itself does not get violated.
And I think, speaking of breast tissue, people might wonder about a mammogram. If you get an implant, can you still get an accurate mammogram?
Yeah, absolutely. Studies show that mammograms are effective in the presence of implants. They will adjust their technique a little bit and perhaps take a couple extra views to be able to visualize the breast tissue adequately, but it's no problem.
Make sure you're communicating with your doctor, that sort of thing.
Yeah.
I think that a lot of times people wonder about the consultation process itself because it's something that's very personal.
Yeah.
So if you come in for a consultation, what can you expect?
Basically, consultations are typically 45 minutes to an hour, and we kind of go through a general physical exam to make sure you're healthy and there aren't any contraindications to the surgery. And then it's about figuring out what you want. What are your goals? And we have imaging systems where we can take pictures of your breasts, pull you up on the computer screen and show, okay, if we select this implant, this is what you can expect it to look like, and work through that process. We also have patients try them on inside of a sports bra to get a sense of the size, and just spend a little time trying to figure out what specifically are your goals, and are those realistic goals? Does that match up with your natural breast dimensions, your height, your weight, all those kinds of things? Because a lot of times patients will look on Google and they'll see a great result. Oh, that patient, that's a 400cc implant, that looks great on her, that's what I want. Well, that's not really what you want, because it's not, your body's different, and so that's important to go through that process individually.
I think it's the same thing when you see a picture of somebody's hair. If it doesn't fit your type or whatever, your stylist might set you right. you do the same thing in encouraging people and what the best tools are for them.
Absolutely.
What's the best first step if somebody's like, you know what, I'm really interested, I want to do this for myself, I've thought about it for years, where would you recommend they get started?
Well, a couple different things. One is they can go to our website and kind of check out the information on there, before and after pictures, and then just come in for a consultation. I think that's the most important thing, is where you can sit face to face with the physician and talk about it and make sure that it's the right decision for you.
And consultations here at Village Point Aesthetic Surgery and Dreams Med Spa are free.
Yeah, absolutely.
And no pressure.
Exactly.
This is obviously an investment, and people might be wondering how to pay for it. Not all of us can walk in and write one big check.
Sure.
So what options are out there?
There's a number of options. We work with different banks that do medical financing, so we do have financing options available for patients.
So a good opportunity to get in, meet the doctors who will be doing the surgery. If you want more information, if you want to call for that free consultation, the number is 402-596-4000. The website is surgeryvp.com. Dr. Johnson, thank you for your time today.
Thank you.
And thank you for joining us.